Welcome to all in Medilife Solutions. This is the help video for edit various portions of prescription after insert from disease template. Enter the patient personal information. Suppose diagnosis is ACS, that is acute coronary syndrome. Now this is the box history, this is the box for history, this is the box for physical examination, this is box for advice, this is box for referral, this is the diagnosis, this is the main treatment box, this is the information drug history box, and this is the investigation box. Now I am editing the existing sentences. Suppose chest pain, the chest pain like 2 days, I enter 2, then only D. If I enter the D, it will be days, because it is written in this text dictionary settings. We will demo later. Now enter the enter button. Suppose shortness of breath. Yes. That if I only enter the SOB, this auto text will come. Suppose this is shortness of breath with orthopnea, 1 days. 1, just enter the D and press the space button, then days. Now I editing this physical examination. Suppose blood pressure, I am erasing this. Better to write blood pressure here. Suppose blood pressure is 150/90 millimeter of mercury. Here there is a crepitation present. Only I write here, then this auto text will come. Suppose bilateral basal crepitation positive, then I press this button, then I will go by pressing the enter button. Suppose heart is normal, heart is NAD. Now I'm going to the advice button. There are few prototype advice. I'm inserting one of them, just only clicking. Suppose this patient is a hypertensive male patient, just click here and this advice will automatically insert. Now I want to edit this referral. I want to refer this patient to cardiologist. Suppose cardiologist, select the cardiologist, then press the enter button. Then I editing the diagnosis. Suppose this is a case of ACS with diabetes, then I write only DM. Then there are many diabetes with other diagnosis come from auto text, then I select one of them. Suppose TM known case. If I erase this, we can also enter other diagnosis. suppose this is a case of hypertension also, HT, hypertension known case. And in that way we will add other diagnosis also. Now how can I edit that treatment treatment windows? It will be demonstrated in further video by a separate video. Now I demonstrating the follow-up only. This test edition will also demonstrated by another video, separate video. Now if I want this patient will come to me 2 weeks later, then only I press 2 spacebar, then W means weeks, only W, then again spacebar, that this written will come automatically, come after 2 weeks. And suppose this is the other information, suppose this patient has a history of tuberculosis, I only write TB, and there are many auto texts will come. Suppose this patient has history of TB lymphadenopathy, treatment 9 months, then I enter. Suppose he has other information like he has a tonsillectomy operation, TON, then auto text will come history of tonsillectomy, then I select, then I enter many of things by this way. We just press the enter button, go downwards, add first 1 or 2 line, first add 1 or 2 words, the other words will come automatically from the auto text manner. And this is the drug history. Suppose this patient is taking Thyrox, suppose Thyrox, THY, Thyrox, then this patient taking other drug, suppose Mdokel, I only write Mdo, that this suggestion will come from in drug history, drug information. In this way we will enter, in this way we can enter the other drug history. And this is the easiest way for editing the various portion of the treatment. But one thing, if we enter the new auto text, this will be demonstrated in further video also. Okay.